Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today on the show, we have Sharyar Baradaran. He is a periodontist. Nick Shamie is an orthopedic surgeon. Together, they co-wrote the Kevin MD article, 6 Tips to Make a Lasting Impact in the Medical Field. Sharyar and Nick, welcome to the show.
Thank you for having us.
Thank you.
All right. So I'm going to ask each of you just to briefly share your story and journey to where you are today, then we'll get right into the article. Sharyar, why don't you go first?
I was born in Iran. It's a Middle Eastern country. I came here to the United States at the age of 12 in 1980 after the fall of the Shah and the revolution. We left the country because I'm from a Jewish heritage, and we living in a Muslim country, we were afraid of being persecuted because of the fundamentalist Islamic government that took over. And I went to an American school in Iran, and as such, when the schools closed, I didn't have the opportunity to continue my education adequately. So my parents, with my 2 other siblings, we left the country. We first went to Switzerland, then to Israel, and then after a few months, we landed in America, and we started a life from over.
Mm-hmm.
And my father was a physician, and he started practicing Cedars-Sinai Hospital in Beverly Hills. I went to Beverly Hills High School, and then to UCLA undergrad, then UCLA Dental School, got my master's there. And then for 2 years, I went to Portland, Oregon at OHSU for my residency. And I've been in private practice in Beverly Hills since 1994. I have 3 beautiful children, 2 daughters and a son, 28, 25, and 19. And my eldest daughters are out of college. They live in New York. And my son is a second year at NYU.
Wonderful. Sharyar, tell us, how has your background, how has that influenced you professionally?
I think it stems back from being raised in a family that cherishes and respects education tremendously. And that became very true when the revolution happened and we had to leave the country. My father and my mom had to leave everything behind. And truly the only thing they could take with themselves was their knowledge. My father was an obstetrician and an infertility specialist who had trained in the United States. And having to leave all his belongings back in his home country, the only thing he had was his brain. And that was something that was very significant and a learned experience for us, the children, the value of education and how important it is to be able to take it with you wherever you can.
All right. And Nick, just briefly share your story and journey to where you are today.
Sure. A similar path to Sharyar's, but I was actually born in the States. My dad was doing his residency at the Detroit Receiving, Wayne State, and he met my mom there. And I was born, and I was 2 when we went back to Iran. And after the revolution, I grew up in a Muslim family. I'm not religious. We don't practice religion. But unlike Sharyar, who was being concerned about being persecuted, being Muslim was not an issue. But my dad actually brought me here because he was worried about my future in a country that is so oppressed. And he wanted me to come here and further my education. I was 12 when I first came here with my dad first, because the Iran-Iraq war was happening and I was going to be drafted to go to war. So he quickly brought me here so I can further my education. And my sister and my mom came a year later. And, and like Sharyar's family, my dad's a psychiatrist and my sister's an ophthalmologist. So in my family, we value education. We love the medical field. I really enjoy taking care of my patients. My dad, who's 86 now, he's still practicing medicine. My sister's an ophthalmologist practicing. So, I think we all believe that, through medicine, you can excel in your life and your career and set an example for your kids. And also be able to help the community. I mean, one of the biggest joys we have as doctors is to be able to help others. That's probably one of those skills that, it just really transforms your life. And like Sharyar said, it gives you the skill set that is, easily transported across borders. If you're a doctor, dentist, or a professional, we've seen many examples of people who have emigrated, and immigrants to this country have succeeded when they come here with a skill set, right? And, that's something that we value and we cherish. And we share that with Sharyar. But the interesting thing is, and that one of the reasons we even wanted to do this is to share with you that despite our differences, Sharyar and I have a lot of similarities. One, you heard, the being from a medical family, but more importantly, we value people. We value what the person is about rather than, so look at the similarities and the common denominator, which is the character of an individual and a good character, rather than what is the religious background or financial status, or those are the things that we didn't care about. Sharyar and I were best of friends back in Iran when we were little kids. I used to go to his house all the time and hang out until I came to the States and my sister went to college. I really didn't know that Sharyar and I have come from a different faith in our families. We never discussed it. It never was discussed in my family. And that's what makes this really a special bond, because we really cared for each other for who we are, rather than what we practice or what our families practice as a religion. So, and that's really, it's really unique in some ways. And we hope to share this story because I think this is what we believe are the true keys to success, is for seeing people for who they are and judging them based on character, not by, what the differences are between us and them, right?
All right. And you tell more about your story in the Kevin MD article both of you wrote, 6 Tips to Make a Lasting Impact in the Medical Field. Sharyar, tell us, how did this article come together?
Dr. Shamie and I, not only being childhood friends, we're neighbors just by pure accident. We live nearly a block from one another. And we reached out to our colleagues to see how we can share our story of being immigrants in this country from 40 years ago. And we're so proud of what we've accomplished as being outstanding members of the society. We've excelled in our professions, and we've become thought leaders in our specialty. And we thought, what better opportunity to share what's happening, especially in light of what's happening in Iran right now, and the unrest and the struggle for freedom. And it's been a highlight in the news. And we thought, both of us come from different faiths. I'm Jewish, Arya is Muslim. He doesn't practice it very much. I practice my Jewish faith more in a traditional, but I'm not religious. He became a spine surgeon. I became a periodontist. We came to America, we lost contact, and then all of a sudden we saw each other and we got back together and reconnected and rekindled our relationships. Our fathers were colleagues. And we live in a difficult time in the world right now. And with the political unrest that our former country is experiencing, I think what wonderful better way to be able to share a lifetime of friendship, of two friends who met in second grade. And now, we're, 55 years old. We have a family. We have a thriving practice. To be able to share how it is to be able to make a life, to be successful, to be tolerant to other people, to be tolerant to other faiths, despite political differences or not. And we thought it would be a great opportunity to share this with the upcoming New Year celebration that we celebrate towards the beginning of spring. So it was just more to share a wonderful relationship of two friends from very young days and now adults.
So Sharyar, tell us, how did he influence you as a clinician?
He's my to-go guy. I am proud and honored to be able to refer my patients, my family members, and my friends to him, because he is an outstanding surgeon and he has an outstanding character. He treats the patients with sincere care and empathy. There's no doubt that, we're both outstanding in our career and we know our trade very well. But the character in which how we treat a patient, how we sympathize with their ailments, how we can relate with their pain. The patients Dr. Shamie sees are very, very difficult patients. These are patients who struggle to walk, to bend, they have chronic pain. So he's very articulate, he's very patient, he's very kind, he has a kind eye, there's a warmth about him. And I think as a physician in the healthcare industry, you need those basic skill sets that I don't think it can be taught. Yes, they can teach you to be a good surgeon. They can teach you to learn technical skills. But I think the innate skills to care deeply and be empathetic to a patient who's in pain and struggling is something that comes innately. And this is a virtue that Dr. Shamie has. And I'm proud to be his friend, and I'm proud to be able to refer him patients. And he saved a lot of lives. I'm very proud of him.
And Nick, there's clearly a lot of unrest in the world, wherever you go, certainly in your home country of Iran, and even here, of course, in the United States. How do you manage to focus on the positive, focus on the bond that you and Sharyar have with everything else that's going on in the world?
First off, I want to say thank you, Sharyar, for all the compliments. I echo the same sentiments about you, and it takes one to know one. The unrest in Iran is obviously a troubling issue that we, not just as Iranians, but as the rest of the world have witnessed how these people are being persecuted for just wanting to speak up for their beliefs. It's a tough time for us because we left our home country to come and realize the potentials that we all have and had, and we have now in a very wonderful place thanks to the opportunities we were offered in this country. The Americans are so lucky to be where we are, because we have truly all the wonderful things that any society wants. Nothing's perfect, obviously, but this is true. I still believe that this is probably the best country anyone could live in, and we're very fortunate. And the fortunes we had, they don't have in Iran. And when we see that, and see that so many young people are getting persecuted and being imprisoned and killed because they want just a small portion of what we all have here, makes us feel like we have to do something. We have all gone to demonstrations. We have tried to share our story with our friends and neighbors. And I've tried to connect, and as a professional, I try to educate the students there. My family has done that. My sister and my brother-in-law have gone back and taught there right before this immediate unrest, because this has been brewing for 40 plus years. Mm-hmm. But I think we cope by trying to do what we can and listening to people who have been there and seeing what we can do to help. And I think by spreading the word about the persecution, the bad things that is happening here in Iran is how we can make a change and make a difference. And I think that the discussions have had an impact. You've seen many celebrities, many dignitaries, many politicians taking a step towards freedom for that country, which gives me great joy to see, for the people of Iran, for the people of the world. So I think we're leading a charge in Iran that is a global charge. The charge is woman, life, freedom. And this is something that we've all strived to achieve in our neighbor countries and in the world. As Americans, we want to promote that. And this is a great example of how we can hopefully change the world for the better.
And Nick, for those clinicians who are listening to this, what are some things that they can do to shine a light into what's going on in Iran and really spread some of these stories?
Well, I think as physicians and as doctors, we have an incredible bond with our patients. We have developed this bond out of trust and out of respect. When someone trusts us to come and for us to treat them, they have a special relationship with us. And when we have the opportunity to talk about this with our patients who are so involved, I think it's going to make an impact, one person at a time, to educate our patients. If they ask us about what's happening in Iran, I think we can really have a great discussion about what's happening, and perhaps one of those discussions will have an impact and will have a domino effect. And I think that's something that as a clinician we can do is to educate our patients, not just about their health and about medicine, about their surroundings and how it's important to have peace in this world, because unrest halfway around the world eventually will have an impact on all of us, right? We've seen that time and time again.
If I may echo Dr. Shamie's comment, we have to keep the narrative alive. And if we keep the awareness and narrative alive, it's now nearly 9 months since this new awareness and revolution in Iran has occurred. The demonstrations that we're having not only in America, but all across the world, peaceful demonstration for our inalienable right to be able to practice our religion, our freedom, and our basic human rights. Talking about it and keeping the narrative alive is the most important.
We're talking to Sharyar Baradaran and Nick Shamie. Sharyar is a periodontist. Nick is an orthopedic surgeon. Together, they co-wrote the Kevin MD article, 6 tips to make a lasting impact in the medical field. Now, I'm going to ask both of you the same last question. We have a lot of clinicians experiencing burnout, especially after the pandemic. Both of you wrote some wonderful tips in terms of how clinicians can sustain and make that lasting impact in the medical field. So I'm going to ask each of you to maybe share one of those more important tips that clinicians can use, and then end off with some take-home messages. So Sharyar, why don't you go first?
Yes, it's been a very, very difficult transition post-COVID in many professions, but I think the medical profession and the health providers were especially hit hard, not only because of the hard and difficult work hours, the emotional struggle behind it, and the psychological impact. And burnout is a key factor. I think in any aspect of our lives, balance is critical. I balance myself in burnout by exercising. I balance myself trying to be present when I'm not working. And I think those are 2 critical attributes for exercising and just turning off, whether it's just for a Saturday morning and going for a 2-hour walk, and being present is critical. And of course, when you exercise, the release of endorphins is just, there's such a rejuvenating, wonderful chemical enzyme that we secrete in our body that replenishes our soul. And lastly, I have to say, you have to sleep well. If you don't sleep well, that is the worst breakdown you can possibly have. And then when you exercise, you feel better, you sleep better. So it does become this interchanging way of trying to balance the stress. And I immensely respect our healthcare providers post-COVID and always, because without them, we weren't going to make it. So I'm proud of them.
All right, Nick, give us one tip on how clinicians can make that lasting impact in the medical field, and end off with some of your take-home messages.
Nicely said, Sharyar. I echo all the sentiments that he shared. And I think, it comes down to balance, like he said. And what I tell the residents and our fellows and trainees, because my job is not just to teach them spine surgery, but it's also to teach them how to be careful about their lifestyle so they can maintain their health, so they can continue helping people. So what I tell them is, despite the fact that when you went into medicine, your job and your goal is to help people, which has to remain the focus, which actually helps with the burnout. Because despite all the political pressures, all the electronic medical records, and all the extra bookkeeping that you have to do, which causes a burnout, I think you got to focus on the patient and why you went into medicine to begin with. I think that's number one. But at the same time, recognizing that if you're not healthy, you can't help others. So I use the analogy of what they tell you on the plane. What they tell you is put the oxygen mask on first before you help the others. And when you're so entrenched in the caring for others, you sometimes forget about yourself. And if you forget about yourself, you can't help others. So whether it be good sleep, exercise, good diet, and seeing the right kind of a patients who you can help rather than patients who don't want to help themselves. If I operate on a patient who doesn't want to help themselves, they're not going to get better. So that's the part that you need to make sure that you put the oxygen mask on first and be completely clear in how you can help others before you could put the oxygen mask on them.
Sharyar and Nick, thank you so much for sharing your story, time, and insight. And thanks again for being on the show.
Thank you, Kevin. Thanks for having us.
Thank you, Kevin.